Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on precautions for physiological neonatal jaundice or the jaundice in newborn. It is very important for you to understand few important precautions. You have to be very careful or the parent has to be concerned when the blood levels of total bilirubin raises above 50 mg per dl. It is an alarming situation and you have to be very careful. You have to be monitoring very closely. Important thing you have to do is you have to feed the baby multiple times. When you feed the baby multiple times, so there will be lot of stool formation and lot of activity in the intestine and lot of stool coming out. When the stool comes out, it will be green, it will be slimy, it will be loose stools and multiple stools. This helps in elimination of these toxic materials from the body. It is eliminated both from stool and also through urination. If the kid is actively feeding and actively passing stool, no need to worry about it. This is an important sign and also a healthy sign. You have to expose your baby to sunlight, maybe half an hour in the morning, half an hour in the evening. You have to expose your baby to the sunlight. When you expose the skin of your baby to the sunlight, all these toxic material, which is unconjugated bilirubin accumulated in the eyes and in the skin, it will be broken down into less toxic material and also water soluble material, and it is eliminated from stool or motion. It is also eliminated from urine. That's the reason you have to importantly expose the skin of the baby to sunlight morning and evening 2 times. The next important thing is the differential diagnosis. The differential diagnosis is, so it is not only the physiological jaundice. There are other forms of jaundice. There are serious forms of jaundice known as pathological jaundice. There are varieties or hundreds of diseases that can cause pathological jaundice. You have to identify what type of jaundice it is and you have to consult an expert in it and take the treatment. Do not take it lightly. It is a serious condition. These are the common precautions you have to take for physiological neonatal jaundice or the jaundice in the newborn.
Fidicus Homeopathy